scientist. We're joined by Dr. Ravindra Gupta, Professor of Clinical Microbiology, Department of Medicine, University of Cambridge, someone who's involved in this study. Thank you so much, Dr. Gupta, for joining us again. First and foremost, if you can, as simply as you can, explain what you have found in this preliminary study.
Okay, so what we did is we took some of the key mutations in this new variant, and we made artificial viruses with this mutated spike protein, and this is what a very commonly done thing. It has very good accuracy when you compare this to the real virus. So we were able to make different mutations that are found in the Indian variant, or this B617. And what we find is that this double mutant does not seem to have any extra resistance to antibodies compared to a virus which has one or other of the single mutations. So in other words, they don't add up to make a very resistant virus. There's still a little bit of reduced sensitivity to antibodies, so it has a small impact, but most people who are vaccinated, the vast majority, will be protected against this this particular combination of mutations. The caveat is, of course, we haven't done the full set of mutations, but we don't expect those full set of mutations to have a very big impact.
All right, and what does this mean in regard to reinfections? Because, you know, there, of course, we do know reinfections are taking place, of course, but in the first wave and the second wave, if you know, you've been infected with the previous variant in the first wave, and now with this variant that has, you know, spread across the country, so there are risks again of getting reinfected?
I think that's true from SARS-CoV-2. Reinfection can happen, and reinfection is more common potentially with variants such as the Indian variant. And the reason is because, as I said, there's a little bit reduced sensitivity to antibodies. So the virus has made some steps towards becoming a bit resistant to our immune responses. But there's another important thing. People who were infected first time around were infected maybe 6 or 9 months ago. And we know that immune responses may start declining. And that's why reinfection may happen anyway, because your immunity has dropped.
But can the antibodies from your previous infection, just to ask this again, can antibodies from the previous infection protect you against this new variant?
Well, so there are two ways of defining protection. Protection against death or severe disease. And the answer to that is probably yes. A previous infection probably protects you against very severe COVID. But it may not stop you getting mild or moderate symptoms and making you feel unwell if you were infected last year. So that's why the vaccine is really important, because the vaccine will boost your immune responses. We know that vaccines produce slightly additional responses, slightly stronger responses than natural immunity. That's what we think. So having the vaccine is really important, even if you have been infected before.
All right, and the vaccine protection is much better than your previous infection, the protection you get from the previous infection. I do know that a lot of you scientists are not happy with this term that was given, I think, by scientists, and then it's been used by the media a lot. This double mutant variant is what we call the Indian variant. There's also talk of another variant, it's been called the Bengal variant or triple mutant variant. But tell us about how we've named it and your findings about these variants.
Yes, so I think the reason they called it double mutant is, I mean, I can understand it, because there were two different mutations in a very critical part of the virus that were not seen together before, and each individually we thought had quite significant effects on how well antibodies are recognizing this virus. And that's why people got really worried and they called it double mutant. And that's why it was important that we did the studies in vitro to show that these mutations do not add up to a very dangerous virus or a very an escape virus. So those are we did the experiments with each individual mutation and then both of them together, and we find that it's quite a modest effect. It's not extremely concerning, as some people have said. On the other hand, we should remember that the virus might be more transmissible because of another mutation further away, and we've seen that mutation also in the UK B117 variant, which is spreading very quickly in India as well. So the speed of spread may be related to the fact that the virus transmits better than previous strains. So we need to just keep that in mind. The triple mutant in West Bengal, I don't think should be labeled that. We should stop using the terms triple and double mutants, I think, and just refer to them as, something else. I'm not sure what that other thing is. You may refer it to
B1617. as you scientists refer to it. I suppose that is the most correct way. In fact, I was going to ask you about that. So we still don't know about how much more infectious or not this new variant is, because this is something, you know, when it was announced in India that there is this double mutant variant there, we were told by the government that we don't know yet about how infectious it is. We do know that there were not enough studies, or we didn't, you know, do enough of the research required into it. And looking at how it has spread now across the country in this second wave, many are jumping to that conclusion, of course, but we still don't know for sure whether it is more infectious.
Yes, it's really difficult to understand whether a virus is more infectious. You need to do very careful studies. And the only time we've been able to do this is for one virus which spread last year, which we are able to find it was more infectious. This B.1.1.7 in the US and the UK, we've shown it to be more infectious and transmit faster. It's really tough to do this. You need very good health data. You need to match sequence data. And I don't think it's going to be possible in India to do this, unfortunately. So I think we should assume that it is highly transmissible, which we can see. But of course, SARS-CoV-2 is already a very transmissible virus. So we already have a problem virus on our hands. What is more important is the fact that this virus has been given the opportunity to spread because of large gatherings in India, which continued at the beginning of this year, and the lack of restrictions. And that is why we have an epidemic and an expansion of cases. That's the root cause of the whole problem. Right.
And Dr. Gupta, that has been talked about a lot, but we're also seeing this time around, and it could be just absolute numbers, that a lot of young people are getting affected and, you know, deteriorating very fast. So again, this is not very clear. There's some reports that oxygen is required a lot earlier than what it was like the last time around. But again, these are all anecdotal, examples that we are given. And for sure, we don't know if this is, on one hand, more infectious, and on one hand, if the illness is more severe.
Yes, I mean, the most obvious explanation for young people getting ill is that, of course, even with the old virus, young people were getting ill. So it may just be because there are so many infections that you're observing a lot of young people, because let's say the number of cases per day is actually more like 2 million. Then you will expect to see, you know, a few thousand young people getting severe disease. So it's all about how many infections are going on as to how many young people you observe with severe disease. So it's probably meaning that there's just really, really high rates of infection in India right now. That's the most obvious thing.
All right. Well, thank you so much for speaking to us here at NDTV again. And of course, we'll be in touch with you about your study and, whether you find it more, right now we do know it's preliminary, and hopefully we will have more details about the study later. Thank you so much for joining us.